the concept that fat can lead to toxicity is kind of overlooked in the low carb, high fat literature. They say that you do it for long enough, you're going to curb your appetite, the fat is going to help you be satiated, but that is not my experience. And the reason it's not my experience is because I see a lot of sick patients, and if I leave them on a high-fat diet, they'll get sicker, they'll get more insulin resistance, just like your husband had.
I am here with Dr. Nadir Ali. Thank you so much for joining me today.
So nutrition is key. I mean, I shouldn't say nutrition alone, but lifestyle is key in my practice. So I have been doing low-carb nutrition, lifestyle medicine since 2012. So it's been a 13-year journey. It's always the conversation in my office, not just by looking at metabolic parameters through their blood work, but also looking at their blood pressure, their lifestyle, their other issues. So the most critical aspect of any interaction with a patient for me is metabolic health. And in the last 12 years, since I've been doing this, people seek me out for that. So my practice has kind of gradually evolved into such that almost everybody coming to me is not coming just for cardiology alone, but they're coming because they really want to improve their health through lifestyle.
Okay, great. So the reason that you're on the podcast right now is we connected at the Collaborative Science Conference in Vegas. I did a talk on this experiment that we were running on my husband, an N-of-1 experiment, where he was not seeing improvements with the carnivore diet alone. He really had to incorporate extreme water fasting and some exercise in order to see any weight loss. And we were still having some stubborn biomarkers such as HDL and triglycerides and HSCRP, ferritin, and, what is lipotoxicity?
Sure. The best way to define that is to say that if somebody has exceeded their personal fat threshold. So let's look at what personal fat threshold means. The body is designed to handle fat in a very specific way. So when you eat fat, unlike protein and carbs, gets dumped directly into the blood circulation. Protein and carbs, they go through the liver. Fat, on the other hand, is put into these fat globules called chylomicrons, which are water soluble. And what happens to those molecules is that they are in search of a fat cell to dump their fat cargo. And this happens very efficiently. The fat gets cleared within about 5 minutes, and the remainder of the fat is then picked up by the liver. Some of that is picked up by the muscles. So the amount of fat in your bloodstream, which is measured as triglycerides, should really be less than 100 in most people who are in a fasted state. When the fat levels are greater than 100, now the norms or the normals, according to medical literature, is 150, and I think that's too excessive. I think 100 is probably more like the right parameter in my metabolically healthy patients. So in people who have exceeded their personal fat threshold, their fat cells are either overstuffed or they are inflamed, or these people have genetically different fat cells that cannot increase in size with increasing fat intake. So in these people, what happens is that the fat gets left in the bloodstream. And the body tries its best to pack the fat as much as possible. It sometimes has to make an enormous amount of insulin to pack the fat into the fat cells. But when it cannot do that, fat gets left in the bloodstream, and that is called high triglycerides. So when there are high triglycerides, that fat is seeking a place to park itself. And when it's seeking a place to park itself, it will try to park itself in the liver, in the pancreas. This is called ectopic fat deposition, because really fat is not supposed to be parking itself there in any excessive degree, and it leads to visceral obesity. And the concept that fat can lead to toxicity is kind of overlooked in the low carb, high fat literature. They say that you do it for long enough, you're going to curb your appetite. The fat is going to help you be satiated, but that is not my experience. And the reason it's not my experience is because I see a lot of sick patients. And if I leave them on a high fat diet, they'll get sicker. They'll get more insulin resistance, just like your husband had.